Hi, I'm Dan Lessard at Health Sciences North. We're here today to talk about a treatment that many people refer to as shock treatment or shock therapy, but actually it's called electroconvulsive therapy. We're here to learn what it is, how it's done, and how it benefits patients. Joining me for that is an expert in this field. She is a psychiatrist, Dr. Lukintu Alak, who performs the procedure here at Health Sciences North. And we have the setup here that she's going to demonstrate and tell you about the benefits of this treatment. Dr. Alak, thanks so much for joining us.
Thank you for having me.
What is ECT?
ECT is electroconvulsive therapy. It is a type of therapy that is offered to patients that suffer from psychiatric disorders where treatments with medications have not worked.
So how does this treatment work?
This treatment works by applying a very, very small amount of electrical impulse to the brain, either on both sides of the brain or just on one side of the brain, with the hypothesis that it will improve the brain function that has not been working because a person has been profoundly depressed or psychotic or manic.
So in some ways this resets the brain to kind of lift that mood or that fog of depression?
That is correct.
Now, how do you go about doing this procedure?
The way that we do this procedure is right here in this ECT suite, which is the day surgery area of the hospital. Before the patient gets electroconvulsive therapy, we have to get a second opinion from another psychiatrist who will also think and agree that this is a safe and an appropriate treatment for the patient. If that second opinion is a no, then we probably wouldn't do the treatment. Then the patient is then medically checked and make sure that their heart and the lungs are fine. Sometimes they see the anesthesiologist to get that clearance and they come for the treatment. When they come here, then they get an anesthetic which will put them to sleep for between 3 to 5 minutes. Then the electrical impulse is applied either on both sides or one side, as I had said earlier, and then the patient go into a state of a seizure, and while that happens the patient is asleep, so they don't know that is happening, and while that is happening we monitor pulse, blood pressure, and make sure that everything is all right. So while this treatment is being done, the patient is being supported by a team of the anesthetist and the psychiatrist to make sure that everything is all right.
And how does this treatment benefit the patients who receive it?
Patients who have been ill for a long time or short time and the symptoms have been very, very severe and the medications were not enough to relieve those symptoms, then this treatment would relieve those symptoms, and it happens sooner than the medications. An example is a patient who has not eaten or drink or sleep properly or function properly or attend to their personal hygiene, and they have not been doing that anymore because the depressed mood is so profoundly depressed. This treatment will help wake them up and get them to be back to what they were.
It really does sound like a reset, so
Yes,
to speak.
that's correct.
Well, thank you so much for demonstrating what this procedure is and maybe clearing up some of the confusion around this. Is there any last thing you'd like to say about this procedure that you think people should know?
I think the burning question is the misconception about ECT, that it is shock treatment, that it is an old type of treatment, but actually it is a modern standard medical procedure that we do in this hospital and elsewhere in the country. The misconception that people have is that when they come for this treatment they will become zombie-like, they will lose their memory, they will not be themselves anymore, but actually it is the opposite of that. We've had patients who have been suffering for so long, who have not gone to work, gone to school, who have been in the hospital for prolonged periods, and then we give this treatment and then we are able to get them somewhat back to what they were, and it will take a period of time before they really get back to their own feet, and then we maintain that either with maintenance treatments, which is now approved for that, or we maintain with medications.
Dr. Alak, thank you so much for explaining ECT to us.
Thank you.
I'm Dan Lessard. This is Health Sciences North.